This is Mississippi Matters on Jackson 16 WAPT.
And thank you so much for joining us for another episode of Mississippi Matters. I'm Erin Pickens. It was about a year ago when we started doing this show. And of course, we do things differently right now because of COVID-19. Well, 11 months after the first case was diagnosed here in Mississippi, we are still dealing with this virus. A lot has been learned about COVID-19, but there are still a lot of things that we don't know and a lot of things we are learning. So today, we're going to delve into more about what we know now about the coronavirus, as well as some of the disparities that people are continuing to deal with, and also why Black and brown people are still a little bit scared to get this vaccine. Our guests with us today are Dr. Damon Haynes, a professor of medicine in the Division of Pulmonary, Critical Care, and Sleep Medicine at UMMC. Also with us today, Reverend Tony Montgomery Sr., the pastor of Greater St. James Missionary Baptist Church. He actually got the vaccine here a few weeks ago. So Reverend Montgomery, we'll be talking with you more in just a moment, but I want to start with you, Dr. Haynes. Tell us more about what you have experienced here in the past 11 months in Mississippi dealing with this virus.
Excuse me. Thank you very much, Erin. It's been quite burdensome on the healthcare system. We take care of patients in the intensive care unit, and also take care of patients with lung disease that I see in the clinic. So that's been a lot. I know everyone's seen on the news about patients on the ventilator and those things that have occurred. But now we're talking more about vaccines.
Mm-hmm. And encouraging people.
And so I've been trying to.
Oh, you can go ahead. Go ahead.
Okay, I've been trying to encourage community members, family members, and church members to sign up for the vaccine when they're available.
And what are some of the things that you've done? I know that you've had some seminars and some conversations with churches, including your own church, Word and Worship. Tell us about the feedback that you're getting and some of the things that you're hearing from people in regard to whether they want to get the vaccine or why they're apprehensive about getting it in the first place.
Yes, so I've had some church members, family members, and even patients who've been hesitant. They've talked about they thought the vaccine may have been developed too quickly. Is it really safe? What are possible side effects? And so one of the things that I've done at my church, I did a couple of weeks ago, we did a webinar, and we addressed some of those myths and talked about why they were false and talked about the evidence behind it. And the feedback from it has been very good. I've convinced several of my own family members, church members, and my patients to go ahead and sign up for the vaccine.
Okay, tell us the magic. How were you able to do that? Because a lot of people have started out by saying, I'm not getting the vaccine. They talk to doctors and experts and they end with, I'm still not getting the vaccine. So what magic are you performing here? I know it's not magic, but what have you done? Or what was it
so
that
one
helped?
of the One of the things I tell them is that they talk about, is there a risk from the vaccine? And I do go through a little bit of data from a big picture perspective without getting into minute details. And I talk to them about the fact that the risk of getting coronavirus and dying from that are much greater than any possible side effects from the vaccine. That's just one thing that I tell them. Then I give them a little bit of the data behind how the vaccines were developed. I tell them that you can't get coronavirus from the vaccine because there's no live vaccine in these two currently available, excuse me, vaccines.
And you touched a little bit about people saying, oh, the vaccine was developed so quickly, but I know I write for a living. I'm not a scientist, so I've never watched a vaccine be developed before, so I don't know how long it really takes. It could take only a few months depending on what it is. I think, is it because a lot of people are watching this literally in real time that they may be a little apprehensive and just in a lack of knowledge about that as well?
Oh, yes, I definitely think so. And, probably the history, if you look at vaccines, people who may know about them say, yeah, it takes a couple of years generally. But this technology, this mRNA technology, these companies have been working on this technology for a long time. Plus, we had templates, I tell them, like SARS and MERS, that helped develop this vaccine more quickly. Plus, there were billions of dollars poured into it from the companies as well as the federal government.
And also, too, what I think a lot of people don't know, like the coronavirus is a thing. It's been around all the time. But COVID-19 is the specific part that was in 2019 that came out that we were dealing with in 2020. So the coronavirus itself has been around for a very, very long time. So I'm sure that there's been research done with that over the years.
That's exactly right. I tell them this type of virus, we've known about coronaviruses. It's just this one, the COVID-19 one, is the new virus.
Mm-hmm. Exactly. So I want to come back and talk with you a little bit more, but I want to bring in Reverend Montgomery. Reverend Montgomery, I don't know if you had a fear in the beginning, but you were able to take that vaccine. Tell us about your journey with the thought process. Were you always one that said, I'm going to get the vaccine, or did you have a lot of questions about it before you actually got it?
Aaron, like many other people in the African American community, I had my reservations about the vaccine, but following the science and just following the full story of how the illness is impacting our community, I decided that we're going to go with the science, and I'm going to trust God on this. But ultimately, it becomes African American pastors have to lead from the front. You can't lead from the back.
And was it that made you decide to go ahead and be at the forefront and be one of the first ones to get the vaccine?
Yes. I have enough friends in the healthcare profession that were able to get the vaccine before me, and their testimonies alone were enough for me to move forward and to try and get my colleagues to join in.
So I'm sure, like others, you went into this thinking, I don't know what to expect. You probably had a lot of some ideas and thoughts, and then probably worrying about after effects or things like that. Kind of walk us through the process of how it was for you going into the facility to get the vaccine, getting it, and then what it was like in the days after.
Yes. Yes, going into the facility, I actually went in with a lot of excitement. I actually had a mentor, pastor mentor, who took the shot 2 weeks before me. And he had already, explained the side effects that he experienced. He's about 10, 15 years older than me, but a trusted mentor. So I was excited about the shot, as were my colleagues. And I was not apprehensive about getting the shot during the shot.
So did you?
Prior to and after this.
Oh, go ahead. Go ahead.
And after getting the shot, I did not experience any side effects from the shot at all. And I also, surprisingly, some of my senior members, we talked the week before I got the shot. And about 90% of my senior members here at my church had already gotten the shot.
That's good. That's very, very good. So they had either done the research or they listened,
yes,
and they were just ready to go ahead and get that. So I want to come back to talk about that with you and Dr. Haynes in a moment about our seniors and them getting this vaccine and encouraging those who
sure,
don't want to. But you mentioned that you didn't have any side effects. You didn't have the sore arm or anything like that. That's the number one thing I hear people say is like, oh, my arm.
I didn't
sore.
have the sore arm, the dizziness, the headache, none of that.
That is good to know, because a lot of people, again, and what we've seen too, people have been documenting on social media, like, okay, I got the shot today and I'm going to track
yes,
myself for 7 days to show people that, and most people say they have the sore arm, but to know that you had no side effects was really good. Now, how long ago was that you got the vaccine?
I took my shot last Wednesday, 10 a.m.
Okay. So then you have a few more weeks before you take that second dose.
And yes, I take the second dose on the 24th.
Good news, good news. Okay, everyone keep it right here. We're back in just a moment talking more with Reverend Montgomery and Dr. Haynes about the COVID vaccine and why it's important to get it. Welcome back, everyone, to this week's Mississippi Matters. And again, we're talking about COVID-19, the coronavirus, something that has taken over the lives of so many people. The conversation for almost a year now here in Mississippi and across the country. We have with us today Reverend Tony Montgomery, the pastor of Greater St. James Missionary Baptist Church, as well as Dr. Damon Haynes with University of Mississippi Medical Center. We've had a pretty good conversation going here about this vaccine, but Dr. Haynes, I want to go back to you because we touched on this before the break, talking about our seniors, our golden age people in our community, and having them be encouraged to take this vaccine, because we know that they're 65 and above are the ones who are being encouraged right now to get that vaccine. What kind of encouragement have you been giving our seasoned people here in the community?
Thank you, Aaron. Yes, we have known since this pandemic began that those who are older and those with chronic diseases were at risk for worse outcomes. And so we've really been pushing and talking with our older and senior and seasoned citizens, as you mentioned, and particularly with my patients. I have a lot of patients who are in that age range, and talking with them explicitly about why it's really important that they receive the vaccine, and talking about what types of things that would occur should they get the coronavirus and not have the vaccine, and really answering their questions and making them feel more comfortable with it. Sometimes they just need a little more information and a little encouragement, and so that's really what we've been trying to do.
And we know that information is so important, because with our senior citizens and our older population, so many of them still remember the stories of Tuskegee, and they have heard so many things about the racial disparities when it comes to health care and vaccines. So what are some of the things that you do to calm them if they have those kind of fears?
You know, I think the first thing we do is acknowledge it, right? We acknowledge the history, whether it be Tuskegee experiment or Henrietta Lacks or other things. And then we have to acknowledge healthcare disparities that exist today, and tell them we know this is real. But then I also say, hey, we have ethics around research trials now that may not have been in place then. And I use myself as an example. I say I received my first vaccine in December, my second at the beginning of January. And I tell them that I definitely wouldn't put myself in harm's way, and I wouldn't recommend anything to them that I thought would be harmful.
And have you found that that's really worked with them? Do they have any maybe family members who may try to discourage it, or are they receiving that information and moving forward and getting the shots?
So honestly, there are two camps. It's been effective with some people, and they say, Dr. Haynes, I trust you. Some of my patients have said, because you say it, I'll get it. And some of my family members and church members have said it. But there are still some that say, I'm going to wait.
Yeah, and that's the thing, the waiting game. I think they're waiting to see what may happen. They, again, watching TV and looking on social media and hearing all of these myths and rumors and,
Yes.
This happened and this happened. And they want to do a wait and see, but we know that the push right now, it is so vital for that age group to get the vaccine now.
Amen, that is correct.
And we talked about Dr. Haynes encouraging our senior citizens to get it, but Reverend Montgomery, we want to segue into you, because we've heard several times people say sometimes people just need to hear from their pastor, they need to hear from their minister, they need to hear from the folks at church. Not that they don't trust the doctor, but the spiritual side of it, people are just so grounded and they want to hear it from someone of faith. So you mentioned that you've had several older people in your congregation who took the vaccine, correct?
That is correct. I've had several that have taken the vaccine, and of course, we were worried that they would not be able to email or get online to make their appointments. And so my initial phone call with them was about, does anybody need assistance trying to get their vaccinations? To which they were telling me that they had already started. Most of them had gotten their first shot. There were still a few who were having problems trying to get their appointment. So we were trying to aid in that process. But yes, church people tend to want to hear what their pastor has to say from a spiritual side. And I thank God that the members here at Greater St. James and I have a great relationship. But two, I took the shot with 3 other pastors, Pastor Buckley from K Chapel, Pastor Rosser, and Pastor Ward. And so they've been at their churches much longer than I have. But again, we felt like let's, as pastors, try to show our members that there's nothing wrong with the vaccine, and if outside of our membership, even other congregations, if they could just see that pastors were willing to get the shot, that would alleviate a lot of their fears and concerns.
It's like leading by example. It's like if you want your congregation to get this shot,
Exactly.
you, as the minister there, the reverend there, you are going to get the shot to show them, hey, I did it. And then again, your success story is great. You had no side effects, not even the sore arm, so that is awesome. What message would you give to those who are watching, not only from the spiritual side, but again, there are so many brown and black people who are just a little apprehensive about getting the vaccine. What encouragement would you give them to go ahead and get it because it's needed and it saves lives?
My encouragement would be in the words of my mentor who I talk with. He's in Michigan, and he said to me this simply. He said, how can we go to a doctor, we don't know where the doctor graduated in his class, but we trust him to prescribe us medication. We immediately go to the pharmacy, and we don't know our pharmacist personally, but we ask the pharmacist to fill out the prescription, and then we take the prescription, not knowing, the pharmacist at all. If we can do all of that and have that kind of faith, why cannot we have faith in this vaccine? Simply put, we're trusting that when we pull up to a gas station, that gas is going into our car, not water. The vaccine is the same. It takes some faith, but when you see the effects of the vaccine, you see how many people who have died, certainly we want to deal with the side effects instead of dealing with death or the loss of a loved one.
Absolutely, absolutely. And one of the maybe positive things that will come out of this is some of our seniors may be a lot more tech savvy too, because I know like my parents have gotten a lot more tech savvy in trying to do things and researching when it comes to COVID-19 as well. And Dr. Haynes, I want to bring you back into the conversation.
Absolutely.
Reverend Montgomery, we were talking about the older members of his congregation and how they stepped up, and a lot of them got that, and we talked with you about that as well. But for those who, again, in the brown and black community who are still apprehensive about getting this vaccine, Reverend Montgomery has some words of encouragement. What are your words of encouragement to encourage this, getting the vaccine?
So I love the analogies that Reverend Montgomery used, because we do put a certain level of trust. Any of us who take medications, right, or receive any injections, we don't really know what's been placed in those medications. We can look at the ingredients. We know it's been approved by the FDA, so I love that analogy. I'll actually start using that some. But I actually spend a lot of time talking to people and say, tell me your concerns. And I ask them specifics and say, what is it that you're concerned about? And then I try to address those individually. And so what I would say to those who might still be apprehensive is, if you have a certain specific thing that makes you apprehensive, ask your physician about it. Ask us about it when we're doing these webinars or virtual summits. Ask those questions, and so that we can answer and help put those fears at ease.
And maybe one silver lining on this, if there is possibly one, is that maybe patients will be more inquisitive, because we know a lot of times people will go to the doctor and the doctor will say, how you doing? I'm fine. Anything ailing you? And they don't have that conversation with the doctor, knowing that, oh, I had this pain or this ache, and they just don't want to talk about it. But I think this is making people a lot more inquisitive. They want to do a lot more research. So maybe this will open the door to them asking more questions and opening the door of dialogue with their doctor.
And we love that. We love increasing, we call it healthcare literacy. So be more informed about your medicines, about your disease states, about your overall health, and ask us when you come see us in clinic. I love when my patients come in with a list of questions. Some people may be a little intimidated, but I love it because that's why we're there, to help answer their questions. And when we do that, patients are much more likely to be adherent to the therapy that we recommend.
Absolutely, absolutely. All right, thank you so much, Dr. Haynes and Reverend Montgomery. We're going to take another quick break and come back with some final thoughts after this. Welcome back, everyone, to Mississippi Matters as we prepare for our closing thoughts here from our guest today and talking about COVID-19. And we have, again, with us today, Dr. Haynes from UMMC and Reverend Montgomery from Greater St. James Missionary Baptist Church. Okay, Dr. Haynes, we'll start with you. One of the big questions that we get all the time, we get emails, we get calls, we get posts on social media. I call, but I can't get through to get an appointment. Y'all have 9 million appointment times. Okay, not 9 million, but and I can't get one. What's going on? So, okay, tell us, is there some kind of magic that, I know I said magic several times, magic that they can do to get through, or do they just have to keep calling?
Unfortunately, there's no magic. You know, the appointments are made. Of course, you can go to the website that's been broadcast and the State Department of Health website, but they go very quickly. I think that's a good thing because it shows how excited people are to get it. We just haven't received enough vaccines yet, but each week we receive more vaccines, and Dr. Dobbs, when he gives his update, talks about that. And President Biden and his administration have a plan now, of course, next week to start letting some things be or some vaccines be distributed by some pharmacies. So it will get better. I know it may be a little discouraging, and those who are a little tech savvy know that they can just hit the refresh button several times a day when they're on the website, and sometimes appointments will pop up then. And so I just would like to encourage my fellow Mississippians to be persistent, be encouraged, and continue checking, and then just sign up when it's available for you.
And I've heard some people here at work say that they have tried on the first day when they all open up and you can't get anything, but a couple of days later, some people may have gone in and canceled, and then appointments pop up then. So I think people try on the first day and they give up, but like you said, don't give up, just keep going and keep trying.
Yes.
And also, too, we want
Absolutely.
to touch just a little bit on the conspiracy theories that are out there. What is it that can be said or done to get people to not buy into the conspiracy theories or know where to go to get the legit information?
Is that for me or for Dr. Montgomery?
Dr. Haynes, I'm sorry. Dr. Haynes,
Yes, so there are a lot of conspiracy theories online. And I would tell folks, please don't buy into those. Go to a trusted source, right? The CDC website is a trusted source. The State Department of Health for Mississippi is a trusted source. Your physician or healthcare provider is a trusted source. Go to the people that are trusted sources, because we know there are many conspiracy theorists that will put things online to try to discourage people.
And then Reverend Montgomery, bringing you back into the conversation as well, and people talking about conspiracy theories. And of course, I'm sure you are a man of faith. You're probably telling people all the time to pray about it and seek good counsel.
I am, and we have to trust that the God that created all of us is more powerful than any pandemic or any virus. And we have to have faith in him that he is going to lead us safely out of this pandemic and into a brighter future.
Some good ending words there from Reverend Montgomery. We thank you so much, Reverend Tony Montgomery and Dr. Damon Haynes from UMMC. And thank you all so much for watching this week as we delve more into COVID-19 and the impact that it's having on our community. Thank you so much for watching Mississippi Matters. Have a great week.